Being from Scandinavia, and I think I'm actually good to say that the weather is not bad today. Because if we look out and north to the Strait of Kattegat, we know that it can be much more rough. But let us not be tricked. We live in troubled times. And climate change can now and then just feel like one more tidal wave in sea of troubles. Because we have fragile international relations, we have reductions in trade, rising nationalism, more conflict, wars even. We have seen disinformation, systematic disinformation, loss of trust in science and in authorities, and we know the COVID pandemic is not the last. So how do we protect and improve health in that context? How do we build a healthier future for everyone when each crisis, in a way, tends to widen health inequities? And my message is that science is one important part of that solution. Through my career, I have tried in different roles to be a champion for science and for the translation of research evidence to policy and practice to bring about impact and change. We need both new insights and discoveries to solve urgent new insights and discoveries, and we need science-based solutions, and they go hand in hand. As a research funder, it's also often a fight between the sort of applied one and the basic ones. It's not a fight, it's not a dichotomy, because we need both. We at Wellcome support science to solve the urgent health challenges facing everyone. We have been around for 88 years, so I'm very pleased to be here to say congratulations to my a bit older sister organization. At Wellcome, we enable and invest in research, but that's just one way we work. We also influence change in policy and practice through advocacy and through dialogues, and we engage communities and citizens and work with partners. We have been fortunate enough, together with, of course, the impact of the global financial market, to grow our endowment. And that means that we have been able to increase our investments in life science in the UK, where we are based as an organization. But however, more important in this context, and as a global foundation, because we're clear we are a global foundation, we have also been increasing research investments in low and middle income countries, especially in Africa and Southeast Asia. Earlier this year, I visited the Wellcome program in Blantyre in Malawi. Many of you know that Malawi is a small country. It's a landlocked country in Africa. But now, recently, it has been experiencing weather events normally only seen in countries with a coastline. Cyclone Freddy, earlier this year, had devastating impact on the country, including a surge in cholera, and still a challenge in the country. Professor Henry Mwandumba, the director of the center, showed me up on the hillside how water had been pouring down almost as a river. And he's working with the Malawian government to really make an impact. So climate is increasingly a factor in every health challenge. And we need, as a health community, to make sure that health becomes a factor in every climate action. Late last year, I also visited the African Health Research Institute in South Africa, in KwaZulu-Natal, also another major Wellcome program. Dr. Collins Iwurju documented earlier the impact on droughts on HIV treatment adherence. What is the link, you would say? No, the link is quite simplistic in some way. People going further to collect water and needing to spend more time on that were not able to go to the health post and actually get their treatments. And he is now funded by Wellcome to investigate impact of flooding on people's mental health. So diseases and conditions, they are connected. We see an increasing incidence and severity of epidemics in these two graphs. This is driven by climate, environmental, and social factors. Increasing temperatures, deforestation, urbanization, and changes in travel and trade patterns. And we know that more than half of human pathogens have been made more severe by climate pressures, heat, rain, floods, at some point in time. And of course, we have seen the illustrations by Mats earlier, how the range of mosquitoes now bring infectious diseases like dengue into new areas. And we also know that COVID-19 was not a once-in-a-generation event, even if we felt it. It can happen more events and epidemics like that in one generation. So we'll need to learn from the scale of impact that COVID had on health and our economies. The positive, the actions we saw, the science delivered. We had a vaccine in 11 months. And now the world has a 100-day mission for new vaccines, for diagnostics, for therapeutics. But as we also just heard on the previous panel, we also saw the inequities inherent in global systems that the pandemic really exposed. And even if we had never been more successful bringing a new vaccine to the globe ever before, 1 year normally can take 8 to 10 years, still there were huge inequities and they had fatal consequences. Climate change. We in the richer countries contribute the most to the global program through our share of emissions. However, the poorest countries already see most of the negative impacts. We have seen that pregnant women and babies are especially vulnerable to heat. Wellcome has focused on this through a set of investments where we have studied the impact of heat stress on pregnancy and births. We also know that there is an overlap between climate impacts and health systems in terms of their vulnerability and resilience. It's easy to understand that places with weaker health systems, they are likely to be places with less resources to also take adaptation actions. So it's a double negative. They're also likely to be places where less research is being done. And research evidence is important for actually making wise investments in policy. So understanding the specific challenges and potential local solutions will therefore be lacking. And that's why Wellcome is now planning to invest in climate and health hubs that can provide both local evidence and also policy support to local policymakers, and can inform which solution will work best in different contexts so that communities can make choices that best support their human health. As I mentioned, science is one of the strongest tools to change the world, but it needs society's support and trust. I talked about disinformation. We saw the anti-vaccine movement as just one example also during the pandemic. Governments and markets are not taking on some of the most urgent challenges, unfortunately. We know that political cycles are short, and politics are increasingly driven by short-termism and media agendas. And we know the fact future generations are not voting today, and at least they cannot pay for lobbying today. Private sector needs markets with purchasing power to invest in research and innovation. Otherwise, there is no business model. That's for sure. So that's why poverty-related diseases and challenges do not constitute such markets and are underinvested in. I understand Hamlet was up here some years ago. He said, "There is nothing either good or bad, but thinking makes it so." Let's think good, not bad. Let's advocate for science and solutions, because foundations can play a unique and vital role in complementing and compensating for these government and market failures. I'm proud to say that Wellcome, together with other partners in a coalition, including WHO, I had the WHO tie today, AMREF and peer philanthropies, we managed to get the Health Day for the first time onto the COP28. It's a start. It's an example of how we can work together to advocate for science and solutions. Foundations, we can fill gaps in understanding, enhance research synthesis and translation. We know there is emerging evidence of the significant impact of climate change on health, and also of health benefits of reducing greenhouse gas emissions. At the same time, in a way, the climate space is more structured when it comes to the use of evidence. They have the IPCC, one authoritative body, that is then translated into collective understanding that is then, of course, negotiated on between governments. We don't have such a strong body that can actually constitute scientific evidence in contested areas in health. We try to work on that. We support the What Works Climate Summit in Berlin later in June. And we hope that by better data, better evidence, we can have better decisions. Because we also need global evidence, not only the local evidence I talked about, but we need global evidence at the heart of climate actions internationally. And it was interesting to see, and some of you noted maybe, the major data shown by Mats in the excellent slides earlier today. They were more or less all from investments from foundations. The Bill and Melinda Gates Foundations have invested in IHME's burden of disease. The burden of disease is one authoritative measure that we can all agree on as at least starting point for conversations on burden of disease. And Wellcome, we have funded and are funding the Global Countdown, another example of collective evidence demonstrating the challenges we are at hand. Because we need a collective science base, but we also need, of course, WHO as a normative authority to ensure quality and legitimacy of those data. I talked about market failures. We have been successful in global health by aggregating global demand for solutions to create more predictable opportunities, like we see in more reliable markets. We've seen that for vaccines, we've seen it for antivirals, just anti-malarials, just to mention a few. This reduces risks in innovation and scaling up of manufacturing, and we need more of those push and pull mechanisms that can drive innovation and really deliver health impact for communities. We are doing this for infectious diseases, in particular internationally, but we need also to think similarly about health-oriented climate adaptation solutions for these communities. That we also need to create predictable market for such solutions. Because we need both development and also the scaling up of new solutions. Gates and Wellcome are funding a large phase 3 clinical trial for a promising new TB vaccine. That's an important investment. But alongside that, the World Health Organizations are convening a TB vaccine accelerator because there are so many other issues around regulation, policy, readiness to make sure that when and hopefully we are successful with developing new solutions, they can be implemented and scaled up. We should do similar stuff in the climate and health space. Do the solutions, but also prepare the policy and practice space so that we can scale up. Finally, we are already investing around 100 million a year on climate and health. We have supported some, but not all the examples shown here. For instance, we have funded 11 countries for assessing interventions to manage heat-related health risks. They are interventions such as resilient food systems, trees to shade outdoor workers, and housing modifications. We have funded 24 teams in 12 countries developing digital tools for early warning systems for climate-sensitive infectious diseases. And we are working at boundaries and across borders, combining, as I said, discovery and solutions to focus on achieving impact. Because partnerships and collaborations across society are essential. Working with communities and countries most affected needs to be a part of it. Connecting research evidence and decision makers from the start, combining researchers and policy communities. Leveraging more investment to a scale that can have impact on both mitigation of emissions and health-conscious adaptations. And I'm so pleased that we have come together and announced today these collaborations between the Novo Nordisk Foundation, the Gates Foundation, and Wellcome. I say that science is one important part of the solution, but it's definitely not the answer to every challenge in the world today. We all know that. But it's still essential to addressing many health challenges in sustainable and equitable ways. Investing in science is therefore a necessary but not a sufficient condition for tackling our joint global challenges. We also need political will and action. To be committed or not to be committed is the question. With more high-quality evidence from research, better policies, and more commitment and urgent action, we can, even in the time of polycrisis, we can ensure sustainable development in a way that allows everyone's health to flourish. Thank you.